Assalamualaikum warahmatullahi wabarakatuh. Hello, today our group will be presenting about checking the specific vital sign of blood pressure. Let's introduce our group member. Number one is Ajeng Gusti. Number two, Asma Fida. Number three, Hesti Dwi. And me, Andika Rahman. Before that, I will read the case and standard operating procedure. And this is hypotension case. Mrs. H entered the clinic on 4 October 2020 at 13 p.m., age 19 years old. The patient said she has experienced dizziness for 3 days, especially when standing from a chair. Mrs. H's job is an editor. Drink less than 1.5 liter per day and rarely does sport. The patient appears limp and pale when examined, while standing looks shaky. After check blood pressure, the patient blood pressure is 80/50 millimeter mercury. The patient diagnosed with hypotension. And here is how to check blood pressure. Number one is definition. Definition of blood pressure is blood against the walls of the artery as a result of the pumping and flow of blood into the blood vessel. The goal number one is to know the general condition of the patient, to know the progress of the patient disease, and the last to help make a diagnosis. Equipment, tensiometer, and stethoscope. Assessment number one is assess the client condition. Does the client have injury, fracture, or burn to the upper extremities? Number two, assess the client age. Number three, assess the client history of blood pressure. The implementation number one is inform the patient about the action to be taken. Washing hand, turn up the patient's sleeve, not too tight or too loose with the cuff. Closing the rubber balloon screw, washing the reservoir, tensimeter must be flat, fill the brachial artery with 3 middle fingers, put the stethoscope diaphragm directly above it. Inflate the balloon so that air enters the cuff until the arterial pulse is no longer heard or 30 millimeter mercury above the systolic value. Open the balloon slowly at a speed of 2 until 3 millimeter mercury per second while looking at the scale and listening to the sound of the first second is systolic and the last second is diastolic. If the result is doubtful, it needs to be repeated. Wait until 30 seconds. Remove the cuff and remove any air that remains inside the cuff. Roll up the cuff and insert into the tensimeter. Tidy up the patient and then the last washing hand. The evaluation number one, the client is comfortable after measuring blood pressure. Client privacy is maintained. Tools tidied up again. Documentation record the client position, arm usage, systolic and diastolic pressure. Compare with previous result or normal mean pressure for patient age. And next, the video how to check vital sign of blood pressure.
Assalamualaikum, good afternoon. My name is Ajung. I'm nurse and duty from 2 in the day until 9 the night. What is your name?
Hi, I'm Hesti.
Hello.
Good afternoon, my name is Asma. Here I will to the head the nurse to take blood pressure measurements.
Okay, nurse.
This time I will check your vital signs a few minutes. Please cooperate, Miss Hesti.
I feel dizzy, nurse.
When did it happen?
I feel dizzy 3 days ago.
Excuse me, I will take off your slippers. What was your previous blood pressure?
My blood pressure is 100/70.
Okay. Your blood pressure is 80/50 millimeter mercury.
Okay, nurse.
Miss Hesti, according to the result of the blood pressure check earlier, Miss Hesti is 80/50 millimeter mercury and metal at 4 o'clock. I will give the medicine that has been prescribed by the doctor. Well, then let me go out first. If you need something, please contact me in the nurse office. Assalamualaikum.
Waalaikumsalam. Yes, nurse. Thank you.
Assalamualaikum. My first incoming here, I will administer the medicine. From data that has been previously reviewed, Miss Hesti has hypotension. Starting from now on, she had to rest more often and drink a lot of water.
Okay, nurse.
Okay, Miss Hesti, this medicine for low blood pressure is taken 3 times a day, 1 hour before meals.
Okay, nurse.
Welcome. Well then, let me go out first. If you need something, please contact me in the nurse office. Assalamualaikum.
Waalaikumsalam. Yes, nurse. Thank you.
Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.